Hello, my name's Nick Faure. I'm a consultant urologist at King's College Hospital, and I'd like to present some of the work I did while I was a postgraduate fellow at Concord Repatriation General Hospital, which is near Sydney in Australia. This work looked at the preoperative functional assessment of men undergoing radical prostatectomy for localised prostate cancer and looked at the correlation between clinical and urodynamic parameters. These are my disclosures. Post-prostatectomy incontinence is reported by nearly half of all men who undergo radical prostatectomy at 6 months, when compared to just 1% at baseline, as according to the Protect study from the UK. The robotic and open surgery for prostate cancer, a prospective multi-centre comparative study of functional oncological outcomes, or ROSE study, was set up in 2017 in the Sydney Health District to assess oncological and functional outcomes of men undergoing robot-assisted and open radical prostatectomy. The secondary outcomes of the ROSE study include the identification of urodynamic, dynamic 3D pelvic floor ultrasound, together with anatomical features that may impact urinary function after radical prostatectomy. The only real anatomical parameter that's been identified to date is the membranous urethral length as identified on MRI scan, as shown in this diagram below. The work I'm presenting today aims to analyse the baseline lower urinary tract symptoms, urodynamic parameters, and correlations between the two of men undergoing open and robot-assisted radical prostatectomy. Methods for this study: baseline oncological demographics together with IPSS, EPIC, and IEF questionnaires were collected at baseline, 2 and 6 weeks, and then 3 monthly up to 1 year. At baseline, men underwent urodynamic studies according to ICS guidelines together with functional 2D and 3D pelvic floor ultrasound. Men didn't undergo urodynamics if they were within 4 weeks of their surgery, owing to the potential risk of infection. The demographic and clinical characteristics of patients were then compared using chi-square and Fisher's tests. At the bottom left shows a functional pelvic floor ultrasound. The prostate is in the bottom right of the picture, and the dotted line represents the membranous urethral length. Looking at the results, 85 men were recruited into the study with a median age of 64.5 years and a median PSA of 6.2. The baseline IPSS scores are shown on the red bars. The blue bars represent the IPSS scores of men in the Concord Health and Ageing in Men project, who is a cross-section of men without a diagnosis of prostate cancer in a similar area. The men in this study were in fact significantly older, with a median age of 77. Despite this, they appear to have a lower prevalence of moderate and severe LUTs. Coming to the results of our urodynamics, 29.5% were found to be obstructed and 44.3% were found to be unobstructed. 14.8% had poor contractility, 62.3% had normal contractility, and 23% had strong contractility. We look at filling abnormalities. 18.8% were found to have detrusor overactivity, 15.3% loss of compliance, 3.5% demonstrated urgent incontinence, with overall 28.2% demonstrating some form of urodynamic filling defect. When we look at correlation of those who reported overactive bladder, 23.5% reported detrusor overactivity, 19.6% showed a loss of compliance, and no abnormality on filling was found in 56.9%. 28.9% of those who reported overactive bladder were found to be obstructed, and 42.1% were found to be unobstructed. When we look at detrusor overactivity on urodynamics, of those, 80% were found to have overactive bladder symptoms. Similarly, of those who were obstructed, 6.3% had severe LUTs, 62.5% had moderate LUTs, and 31.3% had mild LUTs. To conclude, overactive bladder, moderate and severe lower urinary tract symptoms appear to be more common in patients undergoing radical prostatectomy than in comparable cohorts of men without a diagnosis of prostate cancer. 29.5% of men undergoing radical prostatectomy demonstrate obstruction on urodynamics. In those with detrusor overactivity on their urodynamics, 80% report overactive bladder. This does mean there are 20% with asymptomatic detrusor overactivity, and these may represent a group whose symptoms significantly deteriorate after radical prostatectomy. And I very much hope to be back in the years to come to present the follow-up results of the ROSE study. These are my references. Thank you very much for your attention.